And I want to bring in Dr. Alok Patel, physician at Stanford Children's Health, for more on this. Dr. Patel, thanks for being here. We just heard about Moderna's results with these new vaccines. They target Omicron and its subvariants. So should people wait until those new vaccines are approved before getting their boosters?
Dan, they should not, for a couple reasons. Because number one, the new vaccines, if and when they do get approved, that'll be Omicron specific, do not substitute for your primary series. That is still very important to get. Also, it's important for people out there to know that even though we talk about this fading efficacy against symptomatic illness, the vaccines are still doing their job in terms of preventing severe illness and hospitalizations. And getting a booster that's available now actually broadens your protection. But to the note about what Moderna is talking about right now, this is positive news. We just have to wait and see what exactly those antibodies translate into in terms of efficacy and what criteria the FDA is going to require for that emergency use authorization.
Now, the Biden administration has secured 3.2 million doses of the Novavax COVID-19 vaccine. And that one works differently than the Pfizer and Moderna vaccines. So what does that mean for the fight against these new variants and the effort to increase vaccinations?
Diane, potentially two things. Now, the first thing is looking at different vaccines and what it might look like in terms of not only mixing and matching, potentially, possibly getting a different booster, but also what it might look like if we have Novavax and we have a new variant. But another important talking point, which is all theoretical, is if there is a population out there who is hesitant for whatever reason about getting an mRNA vaccine, which is the newer generation, even though they're completely safe and they will likely represent a larger proportion of vaccines in the future, getting a more traditional vaccine, such as what Novavax is or Johnson & Johnson, may urge some of those people out there to go and get their shot. That is not the direction we wanted to go in, but I think it is important to have multiple options out there and to make sure that we're still paying attention to vaccine equity across the world and not letting shots go to waste, which is what's happening.
And Dr. Patel, throughout the last 2.5 years, we've seen variants and subvariants, now subvariants of subvariants. Will this ever stop, or is this just what we do now?
I wish I could tell you, Diane, if we're not going to see more subvariants of subvariants of subvariants, but this is the nature of viruses. You and I have been talking about this for more than a year and a half. If we continue to let them replicate, they will mutate. We're at the point now where if you look at a genetic tree of all the variants, BA.4/5 is the most genetically distinct variant from the original strain. And that is essentially telling us that it has the capacity to be more transmissible, more effective, and evade our antibodies from natural immunity and from vaccines. What's going to potentially happen in the future? Could BA.2.75 in India outcompete BA.5? These are all unknowns, which means that we have to stay vigilant. And instead of just constantly chasing this with a bivalent, pay attention to ventilation, masking, and staying home when you're sick. We're not out of the pandemic yet, even though we're tired of it.
And now, according to the CDC, only about 1.5% of the roughly 19.5 million children that are 6 months to 4 years old who are eligible for the COVID-19 vaccine now, really small percentage there have gotten at least one dose. So what do you make of that number?
I'm not surprised. This tells us that we need to do a little bit more listening to parents and what their concerns are and make sure that we're urging people to go out and get those vaccines, especially parents of kids who are under the age of 5, because they still protect. Rather than constantly talking about the fact that a new variant is coming, remind people that the vaccines still protect against severe illness. That's extremely important, especially for those kids under the age of 5 who have underlying medical conditions. It's 20 million of kids need to go out there and get that shot.
All right, Dr. Alok Patel, thank you as always.
Diane, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.